Let's address the point that many men were saying that at least you survived in the comments of the previous video about the average length of an assault. First of all, we can't guarantee that anyone survived. They may take their own because of the trauma, or they are so traumatized that the rest of their life is effectively ruined. Next, no one gets to decide, on behalf of another person, how much suffering they should be willing to undergo instead of just, that's a personal decision. For example, if a cancer patient comes forward and says, hey, this is too painful and I don't want to do this treatment, I would rather just, that's their right. Also, in that case, they are still working with care workers who are trying their best to take care of them. These are benevolent people around them. This clearly tells me you have not experienced severe pain or trauma. I am a multi-organ tumor survivor. I once had an experience where a veteran healthcare worker, tough lady who had worked in a cancer center for 10 plus years, broke down and started begging me for forgiveness because of a test she had to administer. And the doctors there, oncologists who have seen people in severe pain, had to step away because they couldn't handle it. And all of these people were still actually just trying to help me. On the other hand, I do get PTSD flashbacks, and those flashbacks are of people who used to smoke in my home space where I couldn't escape from because they just didn't think my suffering or sensitivity was that much. In fact, the most traumatizing part of that was the dismissal of my pain when I said, hey, this causes me suffering and I live in fear of it. Dismissal is in of itself very traumatic, especially when it comes from the folks who have the power to hurt you and you cannot escape from. Say, for example, men in the world as a woman. Take those 2 points and imagine for a second that someone is enjoying giving you pain. Someone is taking pleasure from you. Now tell me that you cannot imagine how deeply that could affect someone. How incredibly earth-shattering that would be to their lives. You clearly have not experienced severe pain or trauma enough to be talking on this point, and if you have, you lack compassion. Do not minimize and dismiss the level of suffering or dismiss all those women who are saying, I would rather than endure this. You should instead be asking yourself, how do I help keep them safe?